watching Fox 4 News.
Everyday scientists work at finding cures for various diseases, and while some are uncurable, doctors are focusing on improving patients' quality of life. That's where nerve stimulators come into play for people with epilepsy. Angel San Juan spoke with one young lady who says it changed her life. In tonight's news for your health.
Alman is a bright young woman with her whole life ahead of her. The story behind the smile, however, is one of pain and seizures. But a small magnet has changed her life.
One day I had up to like 10 or 11, and that was before my VNS.
10 or 11 seizures. Tina was in a car accident with her brother in high school.
Airborne over into a ditch, like a steep one, and something knocked me in the back of the head. There was I think it was a speaker box that was in the back seat, and then I was out.
Tina suffered from short-term memory loss and bleeding in her brain, but within a year, she knew something still was not right.
In 10th grade, I was at school when they first started happening, and I had to go to the nurse. I was like, I need to go to the nurse. I don't know what's happening. And they were like, tell me what's going on. I was like, I can't explain these feelings. They're weird.
After several different doctors examined Tina, she was diagnosed with epilepsy.
Pedimon is where I stare off. I'm like in my own space, and I get really scared because I can't really do anything about it. I just have to wait.
She started seeing Dr. Nestor Pune, a neurologist who works at St. Elizabeth's Hospital.
I think one of my biggest strengths actually is I look at my patients as if I'm the one there. It's kind of hard.
Dr. P, as he's called, gave Tina two options.
We are very honest. We tell them exactly what it is, you know. Sometimes, of course, not all patients will be happy with us. It's like any other offices or any other person. But we try our best.
Brain surgery, that, like I said, that was when I was having a lot of seizures. And that scared me. And then he told me about VNS, and I was definitely up for it.
VNS is a magnet system that is implanted in her throat, and the other she wears on her wrist.
My voice goes out every 5 minutes for 30 seconds. I'll give you an example. It just went out. So swipe it. My voice is out right now. And it's 5 minutes every 30 seconds, so I'm like a robot.
So we implanted the vagus nerve stimulator, and we have seen good results. She's not completely seizure-free, and we don't expect that normally in patients with vagus nerve stimulator.
But Dr. P has given Tina the highest quality of care and treatment possible.
Every time I see a case like Tina, and I'm really happy for them. And, you know, I think she can feel it. Because every time I see her, I have this smile with her, I joke around with her. And are you ready to get a Mickey Mouse voice about the stimulator?
But all smiles and jokes aside, Tina is thankful to Dr. Pune and to science for allowing her to be just like any other 23-year-old woman.
You know, a while back before this, you know, every time I think about the future, I'm like, how am I going to do this? You know, go through my life, and it's just going to be, I'm very thankful because I could have it so much worse right now. So, but now that I have this, it's a lot more positive when I do think about the future and everything.
A future she knows will include the doctor who gave her hope after such a tragedy.
Pretty much no matter where I live, I think whenever I have a doctor's appointment, I'll probably fly or ride or whatever I have to do just to come back here for an appointment.
Angel San Juan, Fox 4 News.
Most people on VNS see a 50% reduction in their medications and have better control of their seizures. Lawmakers are getting